thanks for joining us on Channels Television. We're glad you could have you join us on Health Matters. Welcome to the show. I'm Joker Rogers. Today, our searchlight is on a non-communicable condition known as asthma. Going by estimates from the World Health Organization, some 235 million people globally currently suffer from asthma, and it's a common disease among children as well. Now, how does asthma come about? How can it be managed? These and other questions will be answered by my guest on the show, who's a senior registrar at the respiratory unit of the Lagos University Teaching Hospital, Idiaraba, Dr. Femi Ojo. Well, thank you so much for joining us on the program today.
Thank you very much.
I'd like to start by, laying the foundation, about asthma for our discussion. What are the causes and also the risk factors for this disease?
A number of things have actually been attributed as being the causes of asthma. But specifically speaking, we talk about two main factors. We have the genetic factors and we have the environmental factors. Genetic factors refer to the genes that are being inherited during the period of pregnancy, and this can actually contribute to development of asthma much later in life. Now, talking about the environmental factors, we're referring to things we've been exposed to at home, things we've been exposed to outside the house, and things we've been exposed to at the workplace. In the house, we have a number of things like dusts from the furnitures. We have things like smoke in the kitchen, smell from soap, smell from detergent, smell from perfumes, from hair fresheners. And we have, smoke from exhaust pipe, outside the house. And of course, smoke from cigarette smokers. We also have exposures to things like paints in the industries and factories, exposure to things like dust in quarries, exposure to things like cement. All these things can actually trigger asthma in so many people. Yeah,
you talked about a hereditary factor. What if, a patient does not necessarily, inherit, the factor, asthma risk from siblings, parents, or generations? What if, can someone just develop it just like that, or does it have to be triggered by all these factors that you've talked about? How does a person get asthma in the first place?
Asthma can occur at any age, but like I said earlier on, genetics, can actually be a predisposing factor, though not all the time. But
what's the percentage of genetics being the factors for asthma?
About 50-50.
Okay.
Okay. So not all the time, but it could be a major factor, a major reason why someone will later develop asthma in life.
I also hear being overweight could also be a cause. Can you tell me about this?
Yeah, obesity has been attributed to one of the reasons why patients can actually develop asthma. Not only that, it can actually worsen the symptoms of asthma. All right.
Talk about the symptoms, of asthma. We now know, what could trigger it, what could cause it. What about the symptoms such as, shortness of breath, for instance, and in some children, maybe wheezing, I think, could be maybe signs of, concerns for parents to say, oh, I think there's something wrong here.
There are a number of symptoms patients can present with. One of them is wheezing, just like you mentioned. But we have cough, which is very common for so many people. Cough occurring almost throughout the day, but usually worse at night and early in the morning. Sometimes it is dry, sometimes there could be phlegm. Wheeze, otherwise known as loud breathing, can also be another symptom that a patient will present with. Then sometimes there could be chest tightness. The patient feels as if there's an heavy object being placed on the chest. Sometimes patient can present with things that will suggest allergy, because asthma is a form of allergy, like redness of the eyes, itching of the eyes, nasal congestion, nasal blockage. There could be rashes all over the body. These are some of the ways by which asthma can present.
What about, what we eat? I know that they say that, some preservatives added to some types of foods and beverages can also trigger asthma.
Yes.
What kind of warning can you give us on this?
That's why we lay so much emphasis on actually trying to identify the triggers. Once you're able to identify a particular food substance, that triggers the asthma, then you have to avoid it. There are so many food substances that can actually cause or trigger asthma. So once you're able to identify it, then you have to avoid it. Sometimes it could be very difficult to actually identify the particular food substance that is causing the asthma. But once you identify it, you have to avoid it. Right.
We also, could it be seasonal, do you think? Is asthma the kind of disease that we can say that it's only at a particular point in a year that the triggers, that people present with it? And meanwhile, we have some people that I think it's a lifelong, ailment for them.
Yes, extreme heat can trigger asthma, and cold also can also trigger asthma. During cold, people are predisposed to viral infections that can actually worsen or trigger asthma symptoms.
How do you tell the difference now? How do you know it's an onset of asthma? Apart from, when we talk about the wheezing and the loud breathing. For instance, how do we differentiate between when someone presents with asthma symptoms when you have flu, for instance? How do you know? How would they diagnose asthma? Because usually flu is common cold. They're just things that you just brush to the side. Oh, I have a cold, and you take vitamin C or whatever it is that they give to you. If they test you and they say that you have maybe an infection, they give you antibiotics and say, oh, for 5 days use it, and that's it. But how do you begin to realize that I think it's something much more troublesome than just a common cold?
When you have some of the symptoms that I mentioned earlier on, like cough that is persistent, wheeze, loud breathing, chest tightness, and some form of allergies, then you have to see your doctor, who is going to go a step further to ask about the triggers, and also the doctor will also examine the chest of the patient, looking at the chest wall, then of course listening to the chest, to see if there are abnormal sounds that could actually suggest asthma. Then the doctor will also go a step further to do a number of investigations that can actually suggest that a patient has asthma. One of them is lung function tests, which can actually show that there's reduced flow of air, from the lungs. Then also it can also show that there's reduced, volume of air that is being taken out during expiration. This will suggest that a patient has asthma. There are a number of other tests that could be done, like chest X-ray, which could suggest that the patient has asthma. There are some skin tests that could also be carried out that can also contribute, to actually suggesting that the patient has asthma. So there are so many things that could be done by the doctor, that will actually tell us that the patient has asthma.
Before you talk about doctor, what about at home? What can you do when you have a feeling that, I think there seems to be a problem here? I'm having some of the symptoms I've never known before, and maybe you can't quite get to the hospital.
I wouldn't want to encourage self-medications because the person doesn't know what is actually happening. So the best thing to do would be to see the doctor as soon as possible.
We'll talk about that in a moment. I've been talking to Dr. Femi Ojo, and we've been talking about the asthma. We're talking about the, what triggers it and all that. So we're going on a short break now. And when we come back, we'll continue with this conversation, and we'll be talking more on when to see a doctor. And of course, we'll be taking another look at the statistics and as it affects Nigeria. In a moment, please stay with us.